Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what schizophrenia is, its symptoms, DSM-5 criteria, diagnosis, treatment, risk factors, comorbidities related to schizophrenia, and schizophrenia and epilepsy. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to the American Psychiatric Association, schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. The National Alliance on Mental Illness describes schizophrenia as a long-term medical illness that compromises an individual's ability to think clearly, manage emotions, make decisions, and relate to others. Symptoms of schizophrenia can be managed, yet there is no cure for schizophrenia. Individuals with schizophrenia can experience symptoms such as visual or auditorial hallucinations and may have beliefs that someone is controlling their mind and body. Dopamine, glutamate, and GABA neurotransmitters are affected in individuals with schizophrenia, and imbalances contribute to the symptoms they experience. According to Mayo Clinic, the following symptoms are associated with schizophrenia: delusions, false beliefs that are not based on reality; hallucinations, seeing and hearing things that are not present; disorganized thinking or speech; impaired communication, putting together words that cannot be understood; extremely disorganized or abnormal motor behavior; childlike silliness to unpredictable agitation. Negative symptoms: lack of emotion, neglect of personal hygiene. According to the Diagnostic and Statistical Manual of Mental Disorders, the following criteria must be met for a diagnosis. Schizophrenia diagnostic criteria: 2 or more of the following symptoms for a significant portion of a time in a 1-month period: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, negative symptoms. For a significant portion of time since the onset of symptoms, functioning in areas such as work, interpersonal relations, or self-care is markedly below the level achieved prior to the onset of symptoms. Additional criteria for diagnosis are: continuous signs of disturbance must persist for a minimum of 6 months. Conditions such as schizoaffective disorder and depressive or bipolar disorder have been ruled out. Disturbances are not occurring due to substance abuse, prescription medication, or another medical condition. If there is a history of autism spectrum disorder or communication disorder that is child onset, the diagnosis of schizophrenia is made only if prominent delusions or hallucinations, in addition to the other required symptoms of schizophrenia, are also persistent for at least a month. Currently, there are no tests to determine a diagnosis of schizophrenia. Tests will be done to rule out other conditions. The following tests are done: imaging tests. Tests such as an MRI or CT scan can help to rule out brain abnormalities such as tumors, scar tissues, stroke, and other changes to the brain. Blood, urine, and cerebrospinal fluid tests. These tests are done to look for chemical changes in the body and rule out heavy metal toxicity, poisoning, and infections. Brain activity testing. An electroencephalogram can be used to detect any abnormal brain activity and rule out conditions such as epilepsy. While there is no cure for schizophrenia, there are treatment options to alleviate symptoms. Medication. There are two types of medication that are available for treatment: typical and atypical antipsychotics. Typical antipsychotics. Known as first-generation antipsychotics, these medications block how your brain uses dopamine and cell-to-cell communication. Atypical antipsychotics. Known as second-generation antipsychotics, these block both dopamine and serotonin. Cognitive behavioral therapy can help in developing coping skills in dealing with the symptoms of schizophrenia, as well as the side effects one may experience from their medication. Long-term care can help with other conditions such as anxiety, depression, and other conditions. Electroconvulsive therapy is often used when medications are not helping to alleviate symptoms and is often used as a last resort. Situations in which ECT will be used are for individuals who are at high risk for suicide. The following are risk factors for schizophrenia. Genetics. Genetics can play a key role in someone developing schizophrenia, especially if a parent or sibling has been diagnosed with schizophrenia. Environment. The environment someone was brought up in can contribute to the risk factor of accumulating schizophrenia. Examples are certain infections, autoimmune diseases, and extreme stress. Developmental and birth circumstances. Complications of fetal development can increase the chances of developing schizophrenia in life. Examples are gestational diabetes, preeclampsia, malnutrition, or vitamin D deficiency. Recreational drug use. Certain recreational drugs used in large amounts has been linked to the development of schizophrenia. Researchers are still debating if it is a direct cause or contributing factor. According to the article, Psychiatric Comorbidities and Schizophrenia, anxiety and depression are very common symptoms for someone with schizophrenia to experience. Additional comorbidities are panic disorder, post-traumatic disorder, and obsessive-compulsive disorder. Researchers estimate that around 50% of individuals with schizophrenia experience comorbid depression, and 47% of individuals with schizophrenia battle comorbid substance abuse. According to the article, Schizophrenia and Epilepsy, is there a shared suspectability? Schizophrenia and epilepsy may share a common pathology of the medial temporal lobe, where complex partial seizures often originate. Some patients who experience complex partial seizures experience interictal psychoses, which can take place during or immediately after having a seizure. According to the article, interictal psychosis of epilepsy, chronic forms of interictal psychosis closely resemble schizophrenia. Many factors are taken into consideration, such as family medical history, learning disability, age seizure activity began, history of status epilepticus, febrile seizures, and the level of seizure activity. Physicians must use caution when prescribing certain anti-convulsant medications because some can induce psychotic symptoms. Interictal psychosis has been reported at higher levels in patients who were taking somizumab, topiramate, and levetiracetam compared to other anticonvulsants. In conclusion, schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. There are multiple symptoms that someone with schizophrenia may experience. Many things need to be taken into consideration for a proper diagnosis, including the time symptoms have been taking place, ruling out other conditions, and the impact it is having on the individual's quality of life. While there is no cure, there are multiple treatment options available. The probability that someone will develop schizophrenia depends on the risk factors. Chronic form of interictal psychosis of epilepsy closely resembles symptoms of schizophrenia. Many factors are taken into consideration, and certain anti-convulsant medications should be avoided to prevent any psychotic symptoms during or after seizure activity has taken place. To learn more about schizophrenia, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.